I think one of the things we know when we're treating patients with PV and ET is that, the primary thing we're trying to accomplish is reduction in thromboembolic risk. We know these patients are at high risk for cardiovascular events, be it, strokes, heart attacks, pulmonary embolisms, deep venous thrombosis, things like that. But I think when we're trying to counsel patients and talk to patients, a lot of the data we're using for what is their risk for these cardiovascular events is based on really historic data that I don't think is very contemporary. And we wanted to see if we could really update that and get a better understanding of these event rates, basically using, large databases, right? And so using this kind of Optum market clarity database, we were able to evaluate over 20,000 patients with polycythemia vera who had data before and after this diagnosis, so we can get a sense for, not only their risk, but risk prior to and after their diagnosis. And I think what comes out of this is really patients who have had a prior thrombotic risk makes you high risk for a cardiovascular event. They're very high risk for a subsequent event occurring. And those that are over the age of 60, which makes them high risk, maybe not as high risk as this group that's had a prior event, but still quite high risk. And even in the low risk group of patients that we would, classify as quote unquote low risk, right? Maybe just treat with therapeutic phlebotomy and aspirin. This group is certainly lower risk, but I wouldn't call them low risk for events. And I think we really need to focus in on this group of patients, understand that this risk for thromboembolic events, even in low risk patients, is quite high, and really try to optimize our therapeutic options for this group of patients as we move forward. So, I think that nothing super surprising in this abstract, and I think that's reassuring. But at the same time, I think it really focuses on the high risk nature of these individuals and gives us some contemporary data to support, the reason we focus on this as a primary treatment goal.